Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Mary-Ellen Turpel-Lafond, who is our lead investigator, commissioner of our In Plain Sight report, and I'm honored to have her here today. I'm also joined here, she doesn't have a speaking role today, but our someone who's has done already and will do extraordinary work, Don Thomas, who's our new Associate Deputy Minister of Health, whose responsibilities include implementing the recommendations of the report, and we're honored to have her here as well. And we're honored to be on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nation, particularly today, particularly given the importance of this report. As all of you will know, in June of 2020, I appointed Dr. Turpel-Lafond to lead an independent review of Indigenous-specific racism in the BC healthcare system, and to recommend actions to make our healthcare system a safe and respectful place for everyone. In November, in an extraordinary report, done in an extraordinarily short period of time, given its substance and importance, and for that we're very appreciative. In November 2020, Dr. Turpel-Lafond released her report In Plain Sight, which outlines key findings and makes specific recommendations for addressing systemic racism in our healthcare system. As you will know from Dr. Turpel-Lafond's report, the findings of the investigation, of her investigation, were unequivocal, and the requirement for action equally unequivocal. I'm pleased to join Dr. Turpel-Lafond again today to release the final report of the Addressing Racism review. The data report offers a more comprehensive look at racism within the BC healthcare system, experienced by Indigenous patients and staff alike, and provides a closer examination of health system utilization and health outcomes data analyzed by the review. It is an extraordinarily important report. I recommend it to you, as I will be recommending it to everyone in our healthcare system. It shows in a different way the impact that racism can have on people in our society, in our healthcare system. It sets targets for action, which are important for all of us. And with that, it's my honor to introduce Dr. Turpel-Lafond. I'll be returning afterwards to talk about some of the actions, working with our team to respond to the report already. But I'm happy to invite Dr. Turpel-Lafond up to talk about the data review and the report.
First of all, thank you, Minister Dix, and I too want to acknowledge that we are on the Lekwungen-speaking people's territories and the home of the Songhees and Esquimalt Nation, and thank them for permitting us to live and work in their territory. I also want to thank everyone for joining today to hear more about the release of this, which is the final report from the Addressing Racism review. As the minister indicated, he appointed me in June of 2020 to look at whether or not in British Columbia's healthcare system there was the presence of anti-Indigenous racism after some significant allegations came to light. And a comprehensive report about the care system at the point of care and the experience of Indigenous people was released on November 30th, 2020. At the same time, we were working to collect and analyze data to tell us more about the performance of the healthcare system in BC and whether or not the personal and individual experiences of racism were relevant or were indicated in terms of the overall health system's performance. So that initial In Plain Sight report did include 24 recommendations to eliminate Indigenous-specific racism. It was actually 23 recommendations, and one recommendation was to have a task force and for the minister to action those recommendations. So I'm very pleased, and I look forward to hearing what the minister has to say about progress on that today. But of course, I'm also very pleased that he now has a senior associate deputy minister who's a First Nations person from British Columbia with immense experience in social care, who has begun to work with earnestness on these issues. So this data report builds on those early reports and offers a baseline measurement of how the healthcare system is performing in BC for Indigenous people, featuring much more detailed breakdowns of the data collected, including by region. It offers further and deeper evidence in support of the conclusions, findings, and recommendations outlined in the review's initial volume of reports. The focus of this data report is on the BC healthcare system's performance for Indigenous peoples and its role as a contributor to health outcomes as measured by that system. It is important to recognize that the data points to inherent deficits in the system that exist and impact Indigenous people. So this report does provide a deeper look at the information collected from the surveys, but also a detailed analysis of the more than 600 submissions we received and the other quantitative and qualitative data that we reviewed. In addition, there's data that has not been reported on today, and I know today is International Cancer Screening, Prevention, and Awareness Day, and that's quite important because there's data in this report on the levels of screening and the rates for screening for cancer amongst Indigenous people in British Columbia. We also looked in this report at multimorbidities and acute and chronic conditions, and we looked at how First Nations people in particular have to resort to use emergency department services, including the triage level of care that they receive, how long they stay, the admission to hospital from the ED, the time it takes for a physician to do an initial assessment, and the return rates for non-admitted emergency department patients, which means how often a First Nations person is not admitted at first instance and has to return to emergency to have their concern remedied or addressed again. We also examined data in relation to the two current public health emergencies that are impacting British Columbians. So first of all, we also looked at the pandemic and of course the opioid overdose and epidemic crisis. We looked at patient complaints and comments with respect to current complaints processes inside the healthcare system. What the totality of the evidence here and the data shows in general is that Indigenous people in British Columbia are receiving services in a healthcare environment that is skewed away from primary preventative care and pushes them into secondary and tertiary care and treatment. The inadequacy at this time of BC's primary care system is evident. There's a high burden of disease amongst Indigenous peoples in British Columbia, and First Nations people in particular of all ages have comparatively lower attachment rates to GPs, general practitioners, and nurse practitioners. And in particular, when we look at that very vulnerable population of Indigenous people and First Nations people 65 years and older, who often need the most routine care, these elders are not attached to primary care at a rate 89% higher than non-First Nations people in British Columbia. And that, in fact, is quite a staggering finding of this data report. Poor access to primary care may be driving the lower screening rates for treatable cancers for Indigenous people. For example, PAP screening amongst Indigenous women is about 68% of that of non-First Nations women, yet cervical cancer amongst First Nations women is 1.6 times higher than non-First Nations women. Similar differences appear in other parts of cancer screening as well. First Nations women clearly are experiencing lower access to health services from the prenatal period, and this is a major concern to me. So we are seeing in British Columbia cases where First Nations moms show up to deliver infants without having had prenatal care, or have less prenatal care than other women in the province. Fewer First Nations women are accessing specialty maternal and child health services, such as obstetricians and pediatricians, despite the evidence that's also recorded here that speaks to higher rates of preterm and very preterm birth, and in the child and youth population, increased rates of asthma, depression, mood and anxiety disorder, epilepsy, and poor oral health conditions, which would suggest a stronger attachment, for instance, to pediatricians and childhood care. The First Nations female death rate due to opioid overdoses in 2020 was almost twice as high as that of non-Indigenous females in British Columbia. And in the COVID-19 pandemic, First Nations females are overrepresented in the number of confirmed First Nations cases. Our reports recommend indicators and provide baseline data for the Ministry of Health to assess progress in achieving substantive equality in healthcare and outcomes for Indigenous people. There will need to be substantial work done to come close to achieving equality, but we must measure and demonstrate whether or not progress is happening. This report does demonstrate that accessing and producing the data, such as the data that's coming out today, must be done in a timely and consistent manner. And I strongly urge the health system and Indigenous organizations and nations to work together and produce timely data to underpin and inform policy decisions and to assure accountability for healthcare improvement in the system and performance in the system. My recommendation in the initial report for an independent and legislated Indigenous Provincial Health Officer is designed to support that. And I did have a chance to just exchange a few words with our Provincial Health Officer before now, where she was talking about her efforts to strengthen her office and her service to Indigenous community, and I was welcome to hear more about that. So our reports, including this data report, present evidence of the impacts of racism, the need for immediate, principled, and comprehensive evidence-based efforts to combat that racism. I'm very interested to hear from the Minister today, and I know from speaking to the Minister earlier that some of this work is underway. We must maintain a strong focus on this work in British Columbia because the healthcare system in BC is a much different experience if you're an Indigenous person than if you're a non-Indigenous person. Indigenous people have inequitable access to primary and preventative healthcare services, which perpetuates and cascades into poor health outcomes all across the lifespan. That's what this data shows and why it's important. And as we think about expanding and developing primary care, it's important that that care be delivered at the point of care in a way that's actively anti-racist and does address cultural safety for Indigenous people. When you combine these inequities with the overwhelming evidence of this racism in the system, it's not difficult to see why health outcomes for Indigenous people are poorer. In addition to supplementing our previous reports, this data report serves as a standalone comment, as I said at the outset, on the performance of BC's healthcare system. The initial report did call for the appointment of an ADM, and I'm very delighted that she's here. And I hope she will take this data report as well, work with the health authorities, First Nations Health Authority, Métis Nation of BC, and others to see that baseline data and measurement is adopted, and that these measures actually change and improve over time through appropriate actions informed by the evidence, but also that validates and is prepared to work on the substantial experience of racism in BC's healthcare system so that it can be eliminated and can be demonstrated to be eliminated. I'm very pleased to hear that the Indigenous health representative and advocate position, when it is established, can receive concerns from people about Indigenous specific racism in the healthcare system. In the meantime, Minister Dix requested since November that we keep a 1-800 number and an email open to be able to receive complaints and address urgent cases. We have done that, and I'm grateful that the BC Ombudsman has agreed to a suggestion we had, which is to take on that toll-free line and to continue to offer that to the public and to First Nations and Métis and Inuit in British Columbia so that the complaints can continue to come forward. And I've offered my support to that process and will ensure that I continue to be involved as this moves forward until the report's recommendations are achieved. Indigenous people who would like to share their experiences of racism and discrimination may still do so by the toll-free number that is available or by emailing the addressing racism at bcombudsman.ca email. These will be available, and there is a web link up on the Ministry of Health website. This work is extremely important work. It's been a great honor to complete these reports, and I'd like to thank and recognize the team that's worked with me, but I'd also like to thank and recognize the Indigenous people who have participated with us, who have said to us very clearly that they would like to see health care and the delivery of health care services so they're treated with respect and equality, and that they can in fact access services and that they can have their needs met when they step forward in British Columbia. I think that's a very reasonable and modest expectation, And I hope very much that the British Columbia's healthcare system can improve its performance, but also improve its concept of care so that we can eliminate the racism that has been there at the point of care, and that we can build out a more compassionate, inclusive system that does not have racism against Indigenous people entrenched in it. Thank you, and I'd be pleased to answer any questions you might have.
Thank you very much, Dr. Turpel-Lafond. And I'm going to say, for starters, and you see it throughout the pages of this report, the first report that was presented at the end of November, this report, which provides substantial support to the conclusions of the initial report, that racism is toxic for people, and it's toxic for care. The situation as it exists, and is depicted in the details of this report, cannot stand. I'm very grateful to Dr. Turpel-Lafond and her team and to every person who took part in this review, and grateful that Dr. Turpel-Lafond will continue to assist us as we implement the recommendations of the review. Her work and everyone's work, courage and commitment, has provided a roadmap for meaningful change. Together with Indigenous leadership, health professionals, colleagues, and partners, we will address systemic racism in our healthcare system and root out its deeply damaging effects. I want to provide an update on the actions we've taken since the initiation of the review, because systemic racism requires systemic action. I have heard from many of the people, and I am grateful.
It's 17 hours.
And, it is overwhelming, the thousands of people who took part in this review. Indigenous people, but also healthcare professionals who showed their commitment to change by engaging in this process in a positive and strong way. But what they also say to me is that they are tired of reports and tired of reviews and want to see action. Upon the release of the report, we committed to advancing the recommendations in partnership with Indigenous health system partners and in collaboration with our federal and provincial colleagues. One of our first actions as government, as you'll know, was to write the United Nations Declaration on the Rights of Indigenous People into legislation and work cooperatively with partners to implement it in practice. As immediate steps, we're providing funding for 5 new Indigenous health liaison positions to be added to existing positions in each authority, as well as in Providence Healthcare, to support patients through their healthcare journey. 9 of the new 32 Indigenous health liaisons positions are now in place, and the remaining are currently in the recruitment process. Health authorities are working with their Indigenous partners to tailor the positions to the needs of their community and to recruit for them. It is our goal that these positions will make a meaningful and immediate difference for Indigenous patients who are accessing our healthcare system today. We have ensured that each health authority board has at least 2 Indigenous members, and have been working with those board members to share best practices across health authorities. As Dr. Turpel-Lafond says, the 1-800 telephone number and email address established during the review will be maintained for the coming months. It remains a resource for people to bring forward stories of experiencing or witnessing racism in the healthcare system, and helps provide support and advocacy. As per recommendation 13 from the report, we appointed Don Thomas, the Vice President of Indigenous Health and Diversity, Equity and Inclusion at Island Health, as the new Associate Deputy Minister of Indigenous Health, to lead the implementations of the recommendations and to coordinate our provincial response. As per recommendation 14, a task team has been identified to drive the recommendations forward, and a governance structure has been finalized that will ensure clear accountability and partnership with Indigenous and health system partners. In parallel to the independent review, the Ministry of Health actively worked to mobilize the health system and cross-government partners for a coordinated provincial response. The BC Patient Safety and Quality Council hold an engagement forum for Indigenous board members and the BC health authorities to come together for shared learning, visioning, and networking. We have asked every health authority, and they are on their way, to put in place an action plan towards the goal of advancing their organizations to be culturally safe spaces. Medical bylaws are under review by the Ministry to ensure consistent standards for cultural safety and humility as an expectation of medical staff privileges. We are recommending changes to our Health Professions Act that is committed to embedding cultural safety and humility into modernizing the Act and aligning to the Declaration on the Rights of an Indigenous Peoples Act. In partnership with the First Nations Health Authority and Health Standards Organization, we are developing an accreditation standard as a means to certify that the organization is measuring up to expectations. We are supporting First Nations primary care healthcare initiatives throughout the province and putting into practice a new model for team-based, culturally appropriate primary care services. And the fact, as this report illustrates in detail, in number and in story, the fact that so many people around our province, Indigenous people, encounter the healthcare system through the emergency room and not through primary care is a challenge to our healthcare system. We're also ensuring that all primary care networks across the province are built on a model of partnership and engagement with Indigenous partners and grounded in the provision of culturally safe services. Together we can direct the change that will give people in BC the confidence that when they arrive at the doors of our healthcare system, they will be seen as they are without bias and prejudice, and with care and respect. Thank you very much. Dr. Turpel-Lafond and I would be happy to take your questions, and I'll welcome Dr. Turpel-Lafond back to the podium.
Thank you, Minister. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You will be limited to one question and one follow-up only. I would also ask that you please unmute your phones. You are not audible until your name is called. First question this afternoon is from Binder Sajjan, CTV.
Hi, Dr. Turpel-Lafond. You've laid out in plain sight how some Indigenous people experience racism in the healthcare sector, and I'm wondering if you might be able to comment on the recent case out of Kitimat where a pregnant Indigenous woman was turned away from hospital, ended up driving to another city and delivering a stillborn. And I'm wondering, Minister Dix, if you can provide us an update on that case as well.
I'm prepared to offer a few comments. I have had a conversation with the CEO of the Northern Health Authority about this particular case. It is a disturbing case. I'm pleased to hear that they will be doing a complete review, and I've urged them to use the findings in this report to make sure that they explore all factors that may have come into play. Of course, my biggest concern is to send my condolences to the mom and to the family. The loss of this child is tragic, and it's tragic for all British Columbians at this time of enormous loss as we cope with the pandemic and many other crises in families. The report that I've released today does talk about the fact that there are going to be First Nations moms who are ready to deliver babies and have not had prenatal care because they have not been able to access that care. I certainly would hope that Kitimat or anywhere else in British Columbia has a process where it can quickly provide access to healthcare services for First Nations and Métis moms and make sure that their health is strong, that they have the needs, that their needs are met, their health care needs are met, and that the maternal fetal supports that they require are provided. And certainly I do think that we need to go over and above what might be done in a normal circumstance because we're dealing with such substantial inequality in terms of accessing services. So I can't say much more about this particular case except that I am taking an active interest in it, and I certainly would like to see a proper and thorough review done. And I do offer my sincere condolences to this family and to the community for which the mom and the family belong.
Binder? Oh, sorry, Minister.
I just start by saying, I think I spoke to this last week, but start by saying that the loss of a child is about as terrible thing as we can imagine, and our hearts go out to the family. And obviously, this is the early stages of a review that will, of course, involve the family, will, of course, involve the health system, and so that review requires that we respect confidentiality and privacy, but we need in our healthcare system to ensure culturally safe care all the time. It is an enormous challenge. Our commitment to that is unequivocal, and we're going to, as we look through these reviews, learn all of the lessons of the review, which include the details of what happened on a day, but also the effects, and some of them are depicted in this report, about the need and the importance of prenatal care. And this report speaks about those issues in a general sense, but what we expect is a comprehensive report. Dr. Turpel-Lafond is providing her advice to Northern Health about that review. And it's our expectation that that review will be comprehensive and address the many issues involved, both individual in this case, but also systemic.
Bender, do you have a follow-up?
Yes, and in speaking to some family members, we're hearing that they're having trouble accessing counseling. So I know you spoke of a line where people can report incidents of racism, but what about what some people refer to as racial trauma experienced by people and supporting people through that? Are there supports available that are timely?
Well, thank you for that. And again, the individual questions, we have to respect confidentiality and privacy, but obviously if those requests are being made, I'll be following up on that personally.
And I can just say that with respect to services that are available, I know First Nations Health Authority, particularly around the investigation and review, because this is very triggering material, not just particularly for that family, but for many others. There are mental health supports available. And if you can visit the website where the report is, you will see how to navigate that. And those are available immediately. And I do think it is very important to recognize that with the experience that First Nations and Métis people have had, there is trauma and there is a need to receive support, but there's also a need to receive care that is actively anti-racist, is culturally safe, and appreciates that when a First Nations or Métis person is going to seek care, they may have had bad experiences in the past. So it's important to strengthen the communication and strengthen the welcomeness to the healthcare environment. And I am really pleased on that front to say that many clinical teams in the health authorities, with First Nations Health Authority and others, are strengthening their skills in that area in response to this report, and that is welcome. More understanding, more support, more acknowledgement of the trauma that might be part of an Indigenous person's experience needs to be there, because we do need to attach Indigenous people and First Nations people more strongly to primary care, and that will require two things: more primary care, but also require care to be delivered in a way that is respectful and culturally safe. So we need to change that. So I'm pleased that there is work underway, but there are trauma supports for those who are struggling and who feel particularly triggered even by this report. And in all of those instances, I highly encourage people to reach out, and I know for a fact that the First Nations Health Authority has been offering significant mental health supports, particularly during this pandemic, and I'd like to just stand them up and thank them very much for that service and that support.
Next question is from Marcella Bernardo, News 1130.
Hi, thank you so much for this report and for taking my question. Can you maybe elaborate a bit on what you mentioned earlier regarding people being forced to use ERs to get treatment? Because there are many examples of this, but maybe you could elaborate just on what you heard from people who are told that their healthcare concerns are not significant until they end up having to go to the ER.
Right, so what the report today found is that First Nations on average are 75% more likely to visit the emergency department than anyone else. And the reason for that is because they are not attached to primary care. And for adults aged 18 to 64 years, basically it's twice higher. So what we're seeing is that instead of having routine health care, that we don't have the continuum. We have the emergency department. So First Nations people are going into emergency department to get care. Their needs become more acute because they don't get primary care. And when they go into emergency, it may not be the place to do the referral, to do the communication, to provide the culturally safe care, because at times emergency departments themselves are in a state of crisis. And it is a place where there can be a lot of security, there can be a lot of intensity happening at any given time, and it isn't an environment in which to get routine care. So when we recognize that in British Columbia, 75% more likely means that we're using emergency services, they do need, First Nations people need healthcare services. They must get their service somewhere, but that should not be the point of care when they're not attached to primary care. And so this is a really important insight in the report, and it's broken down by region. Some regions have a very high dependence on emergency care, like the North Region, but other regions do as well, and that includes our major urban centers. And so the build-out on primary care must be a priority in terms of addressing and improving health conditions for First Nations people in British Columbia. And I recognize in the report that First Nations Health Authority has had like a virtual doctor of the day, where you can have a virtual appointment with a doctor. Many First Nations people say they appreciate it because they feel it's more culturally safe to have a virtual doctor of the day, but it doesn't have the continuum of care. We need to build out the primary care system and continue that work, and I appreciate that's not going to be built overnight, but what we're seeing here is these types of interactions where First Nations people are going in crisis in an emergency room because they haven't had care is the type of situation that actually compounds the racism, leads to greater abusive interactions and negative interactions, and this cycle needs to be broken.
And this issue of primary care is a very significant priority of the First Nations Health Authorities and ourselves. It's why we are working together and implementing and expanding with primary care networks, all of which involve Indigenous partners around the province and also centers in different parts of the province. Our goal is 20 new centers in order to expand access to primary care, because a lot of what you see in the report, and people may say a lower uptake for FIT tests or for other forms of cancer screening, but those really reflect, if you're going to deal with them fundamentally, you can make an effort on that one measure to improve things, and it's my expectation that BC Cancer will under our Indigenous cancer strategy. But to fundamentally change them, you've got to expand out access to primary care so that the first engagement is not in the emergency room. A lot of British Columbians, of course, feel the lack of a family practice doctor or nurse practitioner right now. But when you consider that and you consider how much higher that lack of access to primary care doctor or nurse practitioner is in Indigenous communities, you understand the impact that can have on health for everyone. It's why primary care, urgent and primary care centers, primary care networks, community health centers, our primary care strategy with the First Nations Health Authority are all part of expanding access to primary care, because in that will be part of a long-term solution. We have to do both. We have to build up the services on the one hand and aggressively implement anti-racism policies on the other hand. It's not one or the other, it's both.
Do you have a follow-up?
I do. It's mentioning the situation that developed with Vancouver Coastal Health having to apologize for vaccines not being delivered to an Indigenous community or remote community in Bella Coola. Can you, either of you, offer more light onto what's going on there and what efforts are being made to ensure something like that doesn't happen again?
Well, first of all, I'm grateful for the fact that there was an apology, and I think we need to strengthen relationships, and I think as we've seen in the first report and the report today, when you see this kind of disparity in health, and you see the challenges in particular that First Nations people have experienced and communities have experienced, it's understandable that there will be significant friction at times, but also on responding to the public health emergency. I mean, I think it is extremely important to stand up and recognize the efforts that are happening all over British Columbia in terms of vaccination and delivery of the vaccine. But because the burden of disease in terms of COVID-19 is very high in the Indigenous community, and because the risk is so high, as you can imagine, the stress, the pressure, and the anxiety is enormous at this time. So it's a time where we have to really pull together and work together. So I'm grateful for the apology that was given. I think we need to learn lessons, and certainly from my viewpoint of looking at this issue, we need to acknowledge that the words that we use and the interaction that we have can reinforce the experience of racism and having a second-class healthcare system. And for the delivery of vaccines for Indigenous people in BC, there are stores that come both from the provincial system and from the federal system. But ultimately, this is a public health emergency, and First Nations people require that vaccine, and they require it to be delivered. So this is a public health initiative, and Indigenous people should not be treated in any way that makes it appear that vaccines are a gift or a special treatment, when in fact they have a high burden of disease and they need these vaccines. And we must respond in a way that supports the need, and it's demonstrable that they have the need. So I would just say that I think some lessons have been learned, no doubt, from this experience. I hope what is sometime, as we move forward, we can deal with this and unpackage it a little bit more. But my concern today is that this isn't happening anywhere else. And I know Dr. Penny Ballum, who is in charge of and has been asked to assist with this provincial strategy. She did engage with us on this report. She did offer a lot of insight and understanding to these issues. And I feel that she has a strong commitment and appreciation to address these issues of racism across the healthcare system and in Van Coastal. But as well, I think she's providing leadership that's prepared to listen and make adjustments as needed. So I'm really appreciative of that. And it's unfortunate that there was any misunderstanding or, difficulties that arose around that incident, because it was not something that I was happy to hear about. But I also was very pleased to see a quick and complete apology, and I think that is important.
Yes, thank you for the question. We've, I think as we embark on this immunization process, it's our clear communication, Dr. Henry, myself, and the health system, that the campaigns have to be done in a culturally safe way. And I think what's clear in this case is we failed to meet that expectation. And for that, we have apologized and do apologize to the people of the Newhawk Nation. I think it's fair to say, and everyone knows this, that in a time when vaccine supply is currently limited, we have to find ways to address the challenges involved in partnership and in respectful communications, and we can and must do better. As Dr. Turpel-Lafond said, Dr. Penny Ballum, who's our executive lead for our BC immunization efforts and the chair of Vancouver Coastal Health, spoke to the chief of the Newhawk Nation as a first step to hear from the nation and to convey our apology directly. In the spirit of reconciliation as well, we've asked Dr. Danielle Ben-Smith, who's the Deputy Provincial Health Officer for Indigenous Health, to work with the Newhawk Nation, with Vancouver Coastal Health, and the First Nations Health Authorities to support the collective effort to rebuild trust and repair relationships and ensure a culturally safe, respectful, and partnership-based vaccine distribution process is established with the nation going forward. This is action, and we have to continue to work on that action together in partnership. People will know that in advance of traveling, Vancouver Coastal Health had worked with the First Nations Health Authority and the Newhawk Nation, but that the timeframes of that work were perhaps insufficient, and the understanding about what was going to happen was different on both sides, for which we take our absolute the responsibility. It should be said that some discussions were taken, and the number of eligible Indigenous individuals over the age of 65, in addition to those working in healthcare in the communities where the intention was that they be identified and be vaccinated. In Bella Coola and the Newhawk Nation, a total of 350 doses were provided as follows. 240 vaccinations were given to acute care staff, long-term care and assisted living residents and essential visitors, essential service workers, as well as vulnerable elderly community members aged 70 and over. 80 vaccinations were provided to Newhawk Nation elders over the age of 65 at a clinic hosted at the Newhawk Community Hall on Tuesday, January 19th by Vancouver Coastal Health, the First Nations Health Authority, and the Newhawk Nation staff. 10 further vaccinations were given to Newhawk Nation's elders on Thursday, January 21st by FNHA via home visits. 10 vaccinations were provided to Newhawk Nations to vaccinate their elders on Friday, January 22nd, and an additional 10 doses are currently stored in a second fridge at the Bella Coola Hospital and are available for Newhawk Nation to continue their own vaccination clinic at the Newhawk Health Center. All of that are the details of the vaccinations that occurred. But again, I want to reiterate, we have to have a high standard of working together. a high standard of cultural safety. We didn't meet it in this case, and I, as Minister of Health, apologize for that.
Next question is from Jason Hoy, Fairchild.
Hi, thank you for taking my question. I have a question for Minister Dix, which is unrelated to this press conference today. My question is, a food courier company, Skip the Dishes, introduced an extra fee to the customer, naming it as BC fee, in response to the government's earlier order on the 50% cap on commission. So the cap fee now transferred to the customer, and the customer may transfer that back to the restaurant and the food deliverer by giving less tips. So what is your comment on the extra fee introduced by the food courier app and the sequential effect from the cap fee?
What I'll do is I'll have the ministers responsible get back in touch with you with an answer on that question. Obviously, my responses there focus on the COVID-19 response in particular, and our health response, and in particular in this case to the In Plain Sight report. But I'm sure we'll have someone. There are people listening to this press conference now who I'm sure will forward the government's response or the appropriate response to you.
Jason, do you have a follow-up?
Great. I don't have any follow-up. Thank you.
Thank you. Next question is from Justine Hunter, Globe and Mail.
Hi, thank you. Minister Dix, first of all, I know that there's been a shortage of supply with the vaccine, but there was a plan laid out to deliver these vaccines to remote and Indigenous communities as a priority. I think the target was 25,000 by the end of January, and I just want to know if you can tell me how far off of that target we are as of now.
Well, we have we continue to, what we laid out in our plan is the order by which people would get the vaccination, and we're going to be reporting on that vaccination program tomorrow morning, as luck would have it, at our modeling and state of the pandemic discussion. It's fair to say that with fewer vaccines than we expected, fewer people have been immunized, but many, especially rural and remote Indigenous communities that were agreed to through the First Nations Health Authority and First Nations leadership, those immunization campaigns have gone ahead, and in fact, they will be going through the second dose. But it has had an impact on every aspect of our first phase strategy. The less vaccine you have, the less fewer people that can be vaccinated. It goes without saying. We've virtually used all of our existing supplies of vaccine. We received another 11,000 doses of Pfizer this week, and we'll be receiving more Moderna tomorrow. Many of those will be dedicated to second dose, however. So our priorities right now are Indigenous communities and acute care, where we've seen significant outbreaks, and those are both part of our first phase plans. But we'll be reporting on detail on the vaccination campaign tomorrow morning.
Justine, do you have a follow-up?
I do, thank you, Dr. Turpel-Lafond. This pandemic has exposed many gaps, and you've noted that Indigenous communities have faced a higher rate of COVID. So how important is it that British Columbia delivers those vaccines to vulnerable Indigenous communities in a timely way?
Well, it has to be a priority. And what we're seeing with the pandemic is a higher burden on Indigenous communities and Indigenous individuals. And in terms of even the institutional outbreaks that have occurred with respect to various facilities, other than seniors' care, we've seen that there's a huge burden with respect to the impact of COVID-19 on First Nations and Métis people in British Columbia. On the urban side, obviously there's going to need to be an effort there that has only just begun very recently. In the community side, I've seen some very positive and important examples, like with Vancouver Island Health Authority, with Cowichan Tribes and Sanemo, as an example. So there was the ability to logistically work quite quickly in those two communities. there are other communities. It's important to get the vaccines to community. And at the same point, the supply chain and the government of British Columbia and the healthcare system has to have the vaccine. And vaccines are coming from, as I understand it, both the federal stores, as I say, and BC. So the priority has to be there. It has to be delivered. And I'm hoping that some of the logistical issues that did happen recently don't happen elsewhere. And if need, there's more support provided so that in a timely fashion, when the vaccine is ready, it gets there and gets delivered effectively, and there's no breakdown in communication. So I feel confident that that will happen. But of course, like everyone else, feel very concerned about the impact on Indigenous people as we can't be deploying that rapidly because we don't have sufficient vaccines. So I too will be listening with great interest tomorrow in terms of the strategies and the constant sort of recalibrating those strategies. But the fact that the government of British Columbia, the Minister of Health, has kept the priority based on public health guidance on providing those vaccines to Indigenous people is important. Communities are important. The urban context will also be important. So I look forward to hearing more about how that will be operationalized in the weeks and months ahead, because we do know who is deeply at risk and deeply vulnerable here, and it is disproportionately First Nations people, and frankly, it's disproportionately First Nations women.
And just to add, I think we've been greatly aided from the beginning of the pandemic, which is well over now a year ago, a year and a couple of weeks ago, when we established our emergency response in the Ministry of Health to the COVID-19 pandemic, that all of our health authorities, including the First Nations Health Authority, have been involved at every stage. And I think that's important and an important part of our response. And you see that in our efforts on immunization. You'll see that over the next couple of weeks with with the smaller amounts of vaccine that we currently have. I think what we've achieved in that immunization campaign on the positive side so far is exceptional. And I'm very proud of our healthcare teams for the work they've done. The fact that all registered assisted living and all long-term care facilities have had clinics, and the uptake, the relatively small amount of vaccine hesitancy, and the impact that that's had on long-term care that we have already seen in outbreaks is significant. In addition to that, the work to try and secure acute care and to ensure that our critical care, our COVID-19 wards, our emergency rooms are kept safe, and the work done with essential visitors in long-term care, thousands having been immunized, and the work that's been done with Indigenous communities, and the very significant clinics that have happened, particularly in rural and remote communities, but also responding to emerging situations in Cowichan, with the Sinamu, with the Nikasley and other First Nations. And we'll see that with even the relatively small amounts of vaccine we have in the next week or two. Adjustments are required, but I would say that in this first phase up to March 31st, we're still told that the vaccine that we expected will be coming in this period, and the priorities that we set remain the priorities. And I'm pleased about how we've responded to this, but I would like more vaccine every day, the day after that and the day after that. The more vaccine we get, the more quickly we can respond, and we are ready to do that. And I can tell you, across the province, the response to immunization has been uniformly, the fact of the immunization, the desire to be immunized across the province has been very high, and that's a very good sign, whether it's in Indigenous communities, whether it's in long-term care, whether it's in acute care, or other priority areas.
That's all the time we have for questions today. Thank you for joining us.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.